Hello, friends. I'm no therapist, but I'm your host, Stephanie Goodman. I'm a wife, a mother, a grandmother, and a woman of faith. Often friends ask me how I have a successful marriage while blending families and staying optimistic in life. This podcast features people with real life stories about success in relationships and triumph over trial. Do you avoid chiropractic care because of being afraid of the traditional snap, crackle, and pop? What if there's a less abrasive and efficient way of caring for your body's needs? My guest, Dr. James Beadle, shares his personal journey of discovering a more efficient way to read the body's signals by correcting the atlas using sound wave technology. Hello, friends, and welcome back to another edition of I'm No Therapist, but today I want to talk to you about our health. There are sometimes experiences that you have that are life-changing, and when that happens, you want to share it with the world. Well, I'm super excited to have my dear friend, Dr. James Beadle, in the house. He's going to talk about his practices, and I'm going to share some of my personal experiences with this. And if this is a kind of healthcare that is beneficial to you, I invite you to reach out to him. James, will you introduce yourself to my audience so they can get to know you a little bit?
Yep, I can do that. So I'm kind of an Orem Knight now. Would we say like I'm. At what point are you adopted into a community? I don't know. Like that's we could talk about that one.
I think it's a 2-year.
Well, then yeah, I was adopted a long time ago. So I moved here from California when I was like 16. But since then, I've basically been an Orem. I've served a mission, gone to grad school. Went to Florida for other things. But I've been an Orem for over half my life. So I think that covers about 2 years. That's about there. Yeah.
So Orem, Utah.
Orem, Utah.
And I've been an Oremite for 15 going on 16 years.
Okay, so about the same time. Yeah, that's a high five on that one.
Right?
That's pretty cool. I like Orem. Orem, like when we had that conversation, like, okay, where do we want to go? Do we want to practice in Hawaii? Do we want to practice, in Timbuktu? Like wherever. I wanted to come back home.
Yeah.
This is my home. I not only is it familiar, but my family's here, and I love the environment of Orem. So,
I do too. I fell in love with the environment of Orem because my online boyfriend brought me down to check out Orem, Utah. I had heard about Orem, but I mostly knew Salt Lake and Provo, right?
Yeah.
But never really Orem. And man, what a treasure it is.
Yeah, I like it. I like it here.
I like that it's very family oriented, and there is a sense of embracing the arts.
Yeah.
And also openness to spiritual gifts and different things of that sort.
Yeah. It's nice because when I was practicing in Florida for the year, like just after I graduated, obviously it's the South, right? And it was beautiful for religion because everyone was like, all right, let's talk about this religion and that religion. And I was like, this is amazing. I love this, right? Uh-huh. And God was everywhere, and it was beautiful, but like you're saying, like the arts was kind of missing a little bit.
Okay.
And it was interesting, like even just being able to talk about God was a thing there, but talking about gifts not so much, and sharing gifts not so much. I don't know why. It was just a little interesting there, but here I think it's very open, or it's like the gift of the Spirit, and when I'm doing something in the office, someone's like, well, where'd you learn that? I'm like, I just learned it now through the Spirit. Like, is that can I say that? Is that okay to say it? Like,
where the God voice talks to me?
There's no certification for that. That's just what it was. So.
Oh, and I have to say, and I hope that we dive into this, but your influence and your talents definitely shine through with your practice. You are in tune with your patients. You're instantly involved with being an instrument of God in helping them back to their health, which,
well, he's a master healer, right? Like, you just hope to be an instrument in his hands and help out someone. Like, thank you for using me today, and that's what you do. Like, it's you can't take credit for what you do.
It's true.
And even in chiropractic philosophy, we talk about how the doctor's not the one that's actually doing the adjustment. Like you're receiving that external force, and then your body's adapting that and using that for good. But it's ultimately their body healing.
Yeah.
I can't cause healing as much as I want to say like, oh, I totally did that. Check that out. Like I can't do that. You know,
Can't take credit.
Can't take credit. And,
Man.
and that's what stinks with healthcare. Like we want to be this evidence based. Like, oh, you do X, you're gonna get Y. And it's like, you can predict maybe there's a possibility, but you really don't know. And it's really one because God, like He's the one that's gonna do that. And then how are you as a person, as a spirit, as a body, it all plays into effect. And it also matters like how am I feeling that day, right? Like if I'm grouchy that day, I'm like, get on the table, like I'm just gonna like I've got to make sure I'm in the right space to be able to create that environment for healing. Right. So and front staff, same thing. Like it's this whole orchestra that you have to make sure everyone is in the right place. The music, that has to be nice.
Yes.
Everything's clean. Like the whole environment has to be there for the person to say, okay, I'm going to start breaking down my walls
here. I'm healing.
I'm willing to heal.
Yeah.
Right. This is the environment to do that. And I've had several people say like, thank you for creating that environment. And it warms my heart because it's like, oh, good, I'm doing it right, because every day is like, am I doing it right? Am I doing okay? And that insecurity is there, but day after day after day, people are just like, thank you for what you're providing here, and it's like, wow, this is just fun. This is fun to be able to serve every day to my community. Like I just love it. I just love it. So, anyways,
I love that.
I can go on about that.
So you grew up in California, and then you moved here to Utah, or you went to
moved here to Utah, went to high school, went to Orem High. Loved it. That was great. I love that experience. Worked at Peter Piper Pizza, right?
No way.
That was my first job. I loved it. Sad when it was gone, but it's the Nickel Arcade now. Right? That's just crazy. But
familiar places around here,
right? And so I was actually. Do you remember Peter Piper Pizza at all?
I do.
Okay, so I actually used to dress up as that purple dinosaur.
Oh.
It was hilarious. It was great.
You heard it right here. That's not Barney.
It was great. It was so much fun. I loved it. Like, just the things you would do with kids. It was so much fun.
To play as a mascot.
Oh, yeah. Like, you're doing,
creature.
like, jumping jacks, and, like, your arms are, like, only this big because your head's, like, gargantuan, right? It's just hilarious. But, like, I would do push-ups, right? Push-ups. Well, my nose is, like 2 feet out here, so I'm like, and I was like, I could do push-ups all day long. This is great, Can't do it in real life, but I can do it in a suit. So
for those of you who are listening, can you imagine what he's talking about? Big purple dinosaur with the nose, probably
it's
an extension of your arm.
Yeah, just
out
about
in front of you.
Yeah,
it's
a great thing.
So fun.
Yeah, it was me and 16.
Childhood memories.
16 years old.
So tell me, what was your experience with chiropractic care? What's the history in your life?
Oh, okay. So this, my first experience, a little bit different than our family's experience. So I'll talk about mine first because it's kind of a cool one. So I was in 4th grade and I was on a swing set, swinging back and forth, and I fell. Right, I'm typical kid thing. So I fall straight in my back, and I don't know how I did it, but I did it, and it knocked the wind out of me. It was scary for me. It was like this scary experience.
Right? When you can't breathe,
it's
not coming in.
And, like,
you
you're
sound
freaking
funny.
out. And you're like, am I gonna die?
Right.
Like when the first time it happens to you, you're scared. You're absolutely scared.
Yeah.
So obviously, like after a while, my breath started coming back, and told my mom. She's like, well, let's take you to the chiropractor. I'm like, okay. So we go to the chiropractor, and I had gone with her before, not really regularly, it's just like, we would just go. But he did the technique, the activator technique, right? So a little clicky device, right? So it's not Crackle Pop. And so he would check my feet and, poke around here and there and do a couple clicks, and all of a sudden I could breathe really well, like way better than I ever had before. And I was like, well, that was weird.
Right.
Okay, like that was an interesting experience. And then I didn't go back until, actually I never went back to him. But when I moved here to Utah, there was another chiropractor that we kind of met up with. But my first experience was with that guy, and I liked him because he used an instrument to adjust, is very gentle. There's no snap, crackle, pop. There is no uncomfortableness.
When you say snap, crackle, pop,
okay,
what do you
so
mean by that?
like when you think of like, you go to any YouTube, crazy video, and they're yanking their neck, they're putting the microphone really close to the back, and so when they snap the back, it's like, whoa, like, just pop, 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 pop,
Oh, yeah.
So that's the snap, crackle, pop.
When you use your physical force to
Yeah, exactly. You're using your hands to adjust. You can use a drop table, like that kind of loud slam.
Oh, yeah.
So there's different variations that you can do, and that's the traditional, like, everyone has to learn that in school. They've been doing it for over 100 years, right? Like it's a thing, right?
Yeah, I was looking up a history about that a little bit. It
Yeah.
started in Iowa.
Yeah.
In
1895.
95?
Yeah. Yep.
Well, I was off just a
hair.
smidge.
So it actually started the same year as X-ray was discovered.
Oh,
Kind of an interesting fun fact, right?
So you can see inside the body and
there you go. And so
adjust it outside.
It started out actually the big guy with the big old beard and everything, and he was into magnets.
Magnets.
So he was into like magnetic healing and energy healing, and he was seeing it as a way to tap into this energy field of the body. Really fascinating stuff. And his son was like, let's get a little more scientific-y, right? If we can say that word.
Yeah.
And it's a very scientific word.
Yeah, that's a very. Write that down.
Scientific E. Yeah, 2 E's on that one.
Ooh,
That's
very
how
good.
it works.
Yeah.
My wife would totally cringe at that. So, anyway, so he started doing a lot of research, right? And that's B.J. Palmer, right? And I can go into the crazy history of that, but anyway, so everyone has to learn how to do that snap, crackle, pop. It's the technique. There's Gronstedt, there's Diversify, like there's a few different named techniques that are doing these kind of what we call harder techniques, right?
Oh, let's go back to the history.
Okay.
So he started using magnets.
Yeah.
To adjust the body.
Yeah. So he would use magnets and I can't remember exactly what it was called, but basically he would use magnets to change the energy flow of the body, right? And so kind of like the magnets that people wear on like their wrists whenever.
Yeah.
Like
my daughter is pregnant and she's wearing these wristbands that have pressure points on them. Yeah. I think maybe they have magnets.
Probably. I mean, who knows?
Okay.
The art of it has kind of been lost for the past 100 years. It kind of stinks,
Yeah.
I think there's kind of a push to try and figure out what was working for thousands of years beforehand and trying to understand it. But I don't know enough about it. I think it's fascinating, but it's not necessarily what chiropractic is. That was his background.
So how did magnets evolve into chiropractic?
So there's a guy named Harvey Lillard. Have you heard of this story at all?
No.
Okay.
Lillard?
Yeah, Harvey Lillard, right? Okay. He has this big old mustache, right? I mean, like it's just back in like that 1895 guy, right? So, anyways, he was the custodian for D.D. Palmer, right? He was the father of chiropractic, right?
Oh.
And so he there's so many different variations of the story, right? It's like how embellished is this going to get? But
right.
the story goes is that he lost his hearing for whatever reason for several years. And so DD was into this, like, okay, like you got this magnet thing, and he's kind of figuring out this like bone pushing thing. And he's like, well, let me just check this out. So he checks out the spine, finds a bone. We don't know what bone. Some people are like, oh, it's the upper neck. Some people it's the mid back. Who knows? Found this bone.
Okay.
Basically poking out of his back. And he's like, let's just push that sucker back, right? So he does that. He goes ka-chunk, pushes it in there. And lo and behold, Harvey Lillard is able to hear again.
Whoa!
How in the heck that happened? I don't know. It's crazy. But like, what's kind of interesting about that story is that I've heard the same story when people go to like mission trips, where they're adjusting thousands and thousands of people in third world countries, and just giving of their heart, and that they've come back and they're like, hey, actually, this person's hearing did come back through chiropractic.
Wow.
Again, how? No clue whatsoever. Fascinating as all get out.
But the back would be associated to the ear.
Right?
Yeah.
It's really interesting. I mean, we can talk about brainstem, going to the cranial number 8, vestibular cochlear. Like, I mean, like, we could go that route. And
we could go. This could be so many chapters.
chapter 1
Chapter
of 952.
Chiropractic Care.
So anyways, there's theories of how it works. We
Okay.
don't know. That's
Sure.
that. When I say
I
that,
can
that's what I
appreciate
mean.
that.
That right. So
Yeah.
I'm very much if you really don't know, then just don't. You just don't know. Like, own up to it. You don't know.
You don't know what you don't know.
You know that you're helping people, but you don't necessarily know how. That's okay.
Yeah.
That's okay to be in that space, right? So, anywho, total segue of crazy fun stories, right? And
That was great. I loved hearing the history of chiropractic care. That
it's
was
fascinating.
Awesome.
It's way fascinating. So that's how it started. So they actually thought they found the cure for deafness, FYI.
Okay.
Right? They were like, oh, we now know how to cure it. And lo and behold, they didn't find the cure for deafness, right? It was like, oh, okay, well, something else is going on, right? And what was interesting in the beginning years of chiropractic, they focused more on visceral issues, like how's your heart, how's your gut, how's your lungs. It was more about that. It wasn't about low back pain, neck pain. It wasn't about pain.
Wow.
It was really about how is your body functioning,
Uh-huh.
right? And the function of the body is 90% of the nervous system. Only 10% is about pain. Right. So,
Really?
When people are like, oh, I go to the chiropractor for this little 10% of the issues that you really have underneath.
Yeah.
It's like, oh man, like, okay, I got to educate you on what chiropractic can really do for the body.
That's really interesting because pain can really blind you from any kind of joy, from being kind to people.
Yeah.
I mean, that's amazing to hear that that's a small amount that the pain is, but it's the body speaking to you, right?
It's the alarm system in the body,
Ah,
right? So we talk about how if you have a car, right, and you have the engine light turns on, it's like, well,
check engine light?
The check engine light, right? You got to look at that. Do you just take duct tape and put it over and be like, no, I'm good now? Like,
yeah, I think that sounds good to me.
And I would say, like, most of us, we do. I mean, we'll take a little ibuprofen, or we wake up and we're like, you know what, I don't feel great. But maybe throughout the day, it'll just kind of calm down, and I'll start to ignore that pain.
I'm really good at that. I'm really good at ignoring my body's pain.
Yeah. Well, and
taking Band-Aids.
What's beautiful about the body, and this is what I love about it, is that your body naturally heals on its own.
Yeah, right.
And so I struggle when I hear patients come back and say, like, oh, the doctor chastised me for not coming in earlier. And I'm like, well, but typically after 2 or 3 days, you're pretty much okay, right? And they're like, yeah, that's what I was kind of banking. I'm like, so why should I chastise you as a doctor being like, oh, you should have come in right away? It's like, you don't know. Like, usually things just calm down and it's okay, right? So there's that aspect that we can talk about. But I don't like to shame people for not coming in as why add that extra layer of frustration.
Well, and I would say too that listening to your body is quite a foreign concept. I think we're living in a day now, depending on how you grew up, that maybe there's more of an opportunity to learn how your body speaks to you. Yeah. And I hope that we can go into that a little bit.
I'd say the younger generation actually understands it better than older generation.
Fascinating.
Just from a practice perspective, people who are even, like maybe 50, 40 on down, they get it. They're just like, okay, there's a little bit of something wrong. I want it to be fixed now. I don't want it to create a problem later.
Okay.
Whereas when I'm working with people who are 80, 90, they're like, I've had this since I was a kid, no big deal. And now all of a sudden I'm, 60, 70, 80. And it's like, yeah, I've got problems and I'm really struggling now. Mm-hmm. And so I don't know if like people saw that. And I don't know. I don't know what that generational change is. But
it's very interesting to see that. And I think there's also the financial side where sometimes we give into those excuses of, well, I don't want to pay a doctor for...
Which who wants to pay anything, right? Like, everyone likes to, hold on to that money.
Yeah.
What I've joked about with people when they start coming into regular chiropractic care, like there's the acute phase that you could talk about where it's like, okay, I've got a sprained ankle and we adjust the ankle. And after like 2-3 visits, like, yeah, you're good. See you later. Goodbye.
Right.
You live your life. Then there's the other perspective where you're like, hey, you know what? I just want to stay in this healthy perpetual motion, right? Like once a month or every other week or something. You just kind of maintenance and such. And those people have a different perspective of health that's different from the other guys, right? The other guys are like, okay, I fell off a tree, I'm hurting. All right, once the pain is gone, quote unquote, I'm healed. I'm good.
Yeah.
Right? So there's that aspect, right? And then you have the other people who are like, you know what? I recognize that pain is 10% of my body. The other 90% is how do I live my life? How's my quality of sleep? How's my gut? Am I able to eat this? Am I allergic to that? Like all of those functions, right?
Okay.
And so those people, the moment that they find something not congruent with their philosophy of what health is, they run to the chiropractor. And it's like, this is fascinating. So really, like I call them chiropractic wimps, right? Because we become this wimp and we say, you know what? I don't want pain. I don't want that little problem, right? I know how my body, and this is what's beautiful. I know how my body feels when it's perfect.
Yeah.
And it's sub-perfect. It's not quite there. And I want to go back to that as soon as possible so I can continue being okay.
So would that be like the impression of something's off? Do you hear
Exactly.
that?
Exactly it. Yeah, something's off, something's not quite right.
Not in balance.
Not in balance. It's hard to describe. We have to kind of use these like weird energy terms almost. Where it's like my energy just seems low or it just seems off. I don't know how to describe it, but it's not quite right. And so I was like, okay, well then let's do something about it. And that's a lot of fun to get. And I'm the same way. I've become a wimp now. Like the moment I feel not great, I run to Dr. Miranda and I'm like, please help me out. I need help. And so like, all right, let's get on the table and adjust. And I'm like, oh, perfect. I'm good now. I'm great.
Makes sense.
Thank you so much. Right.
Yeah. I'm excited to share some of my stories of how your chiropractic has touched my life as well. So I want to go into how did you decide to go on this path of chiropractic care?
Okay. So that one was unique. So, like I was saying, I had that activator doctor, right? And it's very well established technique. It's been around since the 60s. I came here to Utah and it was more of the snap, crackle, pop type of thing. And honestly, I was looking for the cheapest chiropractor. I'm like, $25. Like, can we go to 20? Like, right. What's the cheapest I can go and just like do a little snap and like, all right, good. I was the acute guy, right? Whereas like I fell off the tree, fine, I'll go to the chiropractor, right? And so that was my experience of chiropractic. And there's a whole spiritual reason. This is episode 5 now. We'll talk about this one, where it's the real reason why I went into chiropractic. It was more of a spiritual journey than anything. Oh. So, but why I chose this particular type of chiropractic, when I went into school, I was fully prepared to learn the snap, crackle, pop because I was very exposed to that at this point.
So even at a young age, chiropractic care was something that you wanted to have in your life.
I knew. I grew up massaging my family's shoulders and feet. I mean, we were a touchy-feely family, right?
Okay.
I knew I wanted to help people. I knew I wanted to serve people. Chiropractic is just the avenue that I was able to play in to help.
Yeah.
That's it, right?
Okay.
And you could be a garbage man and you serve people. Like, however
True.
you want to, however you want to view it. Like, as long as you find a way to serve.
You could be a podcaster.
What?
And serve people.
Wow, that's deep. You should do that.
Yeah.
Wait.
I'm thinking.
So,
but I'm no therapist. So.
No, you're not. But, you are amazing at what you do. So you help me out a lot. So I go to school, right? Knowing that I'm ready for this snap, crackle, pop. I remember the activator approach from when I was a kid.
Yeah.
That was a really cool technique. So I looked around to figure out what school was teaching that also. There was another technique called chiropractic biophysics that was really fascinating to me, where I talked to someone before going to school. He's like, I can permanently change the curvature of the spine. I was like, what? That is ridiculously awesome. I want to learn more, right? So I went to back to California to learn that technique and also activator, because that was where they were teaching it, right? So I go there fully prepared to learn these other techniques. And as I started learning more and more and more, I started realizing that it's not just about structure, but it's also about function. And that really function precedes your structure, right? It's more important than the structure, right? I can have a perfect spine, but I could feel pain every single day.
Okay. Yeah.
Right. Makes sense, right?
Yeah.
So we go in and out of misalignments all day long. It's the matter of, do you get stuck in that misalignment, and then we got issues, right? So anyways, I'm at school, and there's this club that's there, and I go to this club, and they're saying, hey, we're having this class, and they started talking about lasers. They started talking about adjusting through sound, and that in order to get certified, you have to have 100% grade in order to pass. So you take your test, and if you don't get 100%, you're at 99. Sorry, you didn't get certified. And I was
99.
like, holy
that's
cow,
strict.
this is intense. And I'm like, I like this. It was this challenge for me.
Oh.
But I was excited to hear about this, again, lasers and sound. Like, this is something completely different. And I was intrigued. What was interesting is that the Upper Cervical Club, which is the brand of adjusting that I do, right? It's called Upper Cervical, and that could be kind of confused with cervix, right? So cervix is not cervical, right? It's different things. So upper neck, if you will.
Okay. Oh.
So yeah. There you go. There you go.
Right,
you got it. Okay.
Woo.
Like different. Yeah. So it works for guys and girls. Okay. So next. Okay. Got to clarify that one. So there was a club there, and I did not jive with the club at all. At all. Did not like them. And I'm like, I'll never do this. I hate them. They're frustrating. They're a pain. And it felt very dogmatic, right? It was like they would go into these long philosophical discussions of how chiropractic heals the whole body. And I was like, it's about musculoskeletal problems. Like, it's about low back pain and neck pain. What do you mean all this, physiology of the body, and I'm gonna make your life force better? Like, this just sounds so hokey to me. I couldn't do it, right?
Okay. So
yeah, I know you're like, this is weird, because now I'm fully on the other side of the spectrum. Like, I was converted. I drank the Kool-Aid, right? So there's a buddy of mine who was a retired military guy, 20 years, Dr. Rick Bolin. He's awesome. He works in California still. And
what's his name again?
Rick Bolin.
Bolin.
Yeah.
Okay.
So he was fascinating because he was a bomb expert, and so he did that for 20 years, right, for the military, and so hearing his stories was always just so fascinating, and we just became best buddies right off the bat. So through chiropractic school, we were companions, right? Whatever he did, I did. Whatever I did, he did. We were just together. And he came to me at one point. And he was like, we should take one class, just one class, of this upper cervical woo-woo crazy stuff, because they're part of our profession, and we might need to refer to them for a weird case or something. Let's just take one class. And I was like, fine, we'll take one class. But out of all the weird stuff, there was this one, I remember a year ago, they talked about sound waves and lasers and really intense adjusting stuff. Let's go back to those guys. And he's like, sure, let's do it.
Why not dive into the deep side, right?
Let's go. We'll take one class.
No toes.
We're not going to do it. We're diving in, right? So we go there, and the teachers who were teaching, Dr. Joe and Carol Ball, they're husband and wife. They practice also in California. Kudos to them, because they did not talk about all the dogmatic philosophy right off the bat. They explained that the atlas, that first bone just underneath the skull, right? Okay. When that's rotated or tilted in a really weird way, right? It could just be a fraction of a degree, just a tiny, tiny amount. It can cause an abnormal response to the brainstem. I was like, okay, I'm following you. Okay. All right. Mm-hmm. And they're like, so how important is the brainstem? I'm like, oh, well, I got this answer because I've already been through chiropractic school for the past year, 2 years, all right? And so I was able to spout off all the different things that the brainstem does. So everything that's automatic in your body, the brainstem is affecting, right?
Sure, yeah.
So you got your heart rate, you got your blood pressure, you got, every cell, every tissue is somehow connected to brainstem.
Okay.
And so that's why it's called the automatic system, the autonomic system, nervous system, right? And so they're like, okay, so if this little tiny bone is in a weird position and it causes a disruption, not necessarily like, causing it where it stops functioning completely, because then you'd be clinically dead, right?
Yeah.
That's where clinical death is no brain function in the brainstem.
Okay.
Right. That's where you're gone, right? And so they're like, how important would this be? I'm like, well, this is critical. This is absolutely critical. And they're like, this is why we spend so much time and energy and effort hyper focusing on just this part of the spine.
Okay. So the atlas is a really important part
Critical.
of our bodies. And I have to say, I've never heard of the atlas until you came into our life.
Yeah. It's there's not many upper cervical chiropractors in comparison to all the rest. There's like 1,200 clinics worldwide. Like there's just not many. There's very, very few.
Worldwide.
Worldwide, yeah. I had to create a
Wow.
website to figure this out. I created a website called ucreferral.com just so I could be like, who's certified in their upper cervical technique, and where are you? Because when I'm trying to refer people when they move,
Right, yeah.
I'm like, where can you go? And it was hard to find people. So I created a website for that because I was just like,
You're a pioneer in Utah County even, huh?
yeah, that's what we gotta do. So yeah. So when I came here to Utah, no one was doing the sound wave adjusting, and so I was like, okay, like this is gonna be huge. Like I need to do it for my family. I need to do it for my community, everything, right? So anyway, so by their teaching, it really helped me understand, like, okay, this is why they're in this philosophy, dogmatic, type of way of speaking for the upper cervical perspective. But I love the science behind it. So once I understood the science, I was like, I'm here. I've got it. Like, you have to get the atlas done properly in order to even be a chiropractor, quote unquote, in my eyes, right? You have to really honor that part of the body. L5, all the way down the low back, there's a lot of duct tape down there. There's a lot of muscles and such. There's a lot of protection.
Yeah.
Up in the upper neck, you don't have that.
Huh.
Right? So I like to kind of attribute it to like the shoulder. Everyone understands that the shoulder has a lot of motion, right? But it can also dislocate.
Yes.
Right? It's easier to dislocate a shoulder versus, your knee, right? So the reason why is because there's so much motion. So anytime you have a lot of mobility, you have to sacrifice your stability. Right?
Really?
So that's how it works, right? So elbow, right?
Okay.
I only have one direction I can go. I can rotate the wrist also, right? But I can, flex and extend.
Right.
I really can't move at much more than that,
Okay.
right? Shoulder, tons of motion,
Sure.
right?
Yeah.
So it can dislocate easier.
Okay.
Well, what about the neck? Well, I can rotate all the way one way. I can rotate all the way the other way. So 180 degrees already.
Okay.
That's a lot of motion right there. Looking all the way up and
Yes.
looking all the way down. That's a ton of motion.
That's true.
Ton of motion. So that means that you have to have these joints in this easy to dislocate position, because you need that motion. You need to be able to look around to be able to see.
Absolutely.
Right? We need that. And so that's why that area is so vulnerable to problems. So a lot of people will fall down on their butt, right? You're shoveling ice or your snow, and you fall down the ice. Ow, you hit your butt, and your low back kind of hurts, and your hip kind of hurts. And you're like, ow, like that's not so fun. So I see that as a chiropractor and be like, okay, well, let's adjust the low back, let's adjust the hip, we'll be good to go. As an upper cervical doctor, very different perspective. I'll be like, okay, well, let's look at the neck. And the person's like, no, but I don't hurt up here. I hurt down here.
Yeah.
I'm like, I'm okay with that. I heard that 100%. I got it, hip and low back. Yeah, doc, that's where I hurt. Cool. So let's look at the neck. And they're looking at me like, I'm in the wrong place. Like, you are not listening to me at all. And it's like, it's okay. Just let me do my exam. We'll check this out. Right. And so it's a very simple test. All it is you lay down on your back and you're looking to see, are your legs even? Right. Just step one. Right.
Okay. I got to stop you right there.
Oh, okay. Yeah.
Because this was my first experience with you in you bringing up my daughter's feet and seeing how off they were. Like, I'd never paid attention to that. And then I saw you swipe one side and then show me how the feet were aligned.
Yeah.
It What?
Yeah. Our nervous system is crazy. I love it. It is the craziest roadmap I've ever had to deal with. And I love maps. Like, it's just a lot of fun. But, like, trying to get a map of the body and the nervous system of how it works, fascinating. Absolutely fascinating. So, but that's exactly it. Like, and you can have, like, an inch shortness on one side of the leg versus the other one. And it's not like your leg is physically shorter. It's like there's a twisting of the pelvis, making it look like an inch off, right?
Right. Yeah.
So, you could have, like, chopped off your leg, I guess, and, like, tried to sew it back on, and you did it wrong, right? But usually it's this functional twisting, right? And so it's a simple test. Again, you're just looking to see leg short, not short. And if it's short, just look one way and see if it gets closer to even. Does it go even all the way? Does it get shorter? How about just looking the other way? What happens? And if you're able to get it closer to even or perfectly even, which usually actually surprisingly it gets even, it's like, okay, well, this low back weirdness is not just from the low back, it's actually from the neck. Very simple. Obviously, there's more complications about it, but from a simple perspective, like that's it. So I go in and check the low back, see if it's tight on one side versus the other. And all right, look one direction versus the other. And sure enough, looking one way calms it down. Now,
if you've been to his clinic, or if you haven't been, this is what you're going to experience. And I call it the military dance. And I work hard to make sure that I am listening, like when you're in ROTC training, right?
Yep.
About hut, attention, or I can't remember.
That's right. I yell at my patients every. No, I'm just kidding.
That's right. Hand up to the front, left hand, right hand, no other right hand.
Right? Yeah.
Back, and it's really interesting.
It's interesting. Yeah.
Have you ever taken your hands and cross them together and then twist them in, and then somebody plays the game of touching the hand and telling you which one to lift?
Oh gosh, yes.
That's how I feel when I'm on.
You're like, no, this is the right hand. No, it's the left hand.
Left hand. Well, let me think. Where's the left? Okay. Yeah. That's how it is for me. But it is so fascinating because I go in with like my hip hurting. And I don't know what the reason is. And you have me do these looking back and forth and up and moving my shoulders back and forth, which is great. And I hope that I pass your test.
Yeah.
And then I really don't have that pain anymore. It's gone. It's subsided.
That's interesting, right? And that, so like that's what's fascinating. Like I valued not only the upper neck, but also valued that activator approach where it's like, okay, I want a really good technique for the upper neck and do that masterfully. Right, I want to own that perfect. I've gone so far as creating a software program to make sure that I can reproduce all the results that I get.
Wow.
Right, so that's actually other chiropractors use that to also duplicate their work, and then we're able to compare and contrast and be like, okay, how are you compared to me? And hey, you're getting better results here. Let's learn from you. And you have a better, so like maybe I'm better with a certain part of the misalignment reducing. And now I can go with my data and say, this is how I do it. This is why I'm better. Let's have a conversation, right? So that's huge. So that's for the upper neck. Again, when you get the upper neck done properly, that fixes like 60 to 80% of the issues that just happen, right?
Yeah.
But then you have like the other part that you're talking about, where it's the activator one, and there's this whole dance that you have to do. And
it's a dance.
And it's a dance. It's a total dance. We call it the activator dance. And
hey, Macarena.
And so like you have to put, like you said, like one hand behind your back, other hand behind their back, and
I guess you would say, hey, activator.
There you go. So what's weird about that one is that how that was created. So let's dive into this one. History is just fun. This guy was like, hey, I hurt here, and this is like the lower kind of mid back, right? So like where your ribs stop in that area.
Okay.
He's like, I hurt here. He's like, but I only hurt there when I move my hand above my head like this. And as he did that, he's laying down on his tummy, right? And he's like, okay, so when I do this and I put my right hand above my head, it hurts. And the chiropractor looked down at his feet, and his leg shot up like an inch. You're like, well, that was weird. Hey, put your arm back down. And the leg went back down to even. I was like, what the heck was that about? Like, this is interesting. I mean, maybe he's not from Utah, so I don't know if he said heck or not. But
right.
But we'll say heck. Yeah, he's
we'll go with heck.
He's now
heck
an Ormite. So, and so he was like, well, that was really weird. He's like, so it hurts right here. So then he pokes at that spot. And he's like, yeah. So when I do this, it hurts right there. So he poked at that spot, and all of a sudden the legs went even again. So he's like, okay, so when you have your arm up here and I poke you where it hurts, all of a sudden the leg went even. What the heck is going on here? Like, this is really weird.
Fascinating.
So they just went through all these different motions trying to figure out this guess and check. All right, when I move this direction, the leg goes short.
Yeah.
Well, if I push somewhere here, when I push here, the legs go even again. Okay, got it. So they started mapping out the body through these motions. And what I love about this is that with, again, traditional chiropractic, the doctor's pushing in on the spine, being like, okay, well, yeah, feel stiff here. Bam, I'm going to blow it up and, pop, 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 pop. Wow, doc, I feel so much better. Like, awesome, right? I increased motion in there. Yeah. You're great. I'm a rock star.
Got energy. See you later. And oxygen back into my spine.
And it's phenomenal. This is more subtle, right?
Yes, it is.
And so
I appreciate that.
Yeah, and so you're doing different motions, like you're moving your own body. Yeah. And then I'm looking to see, okay, when you do that motion, does your body like it or does it not? And that's really what I'm looking at.
Yeah. So you're talking to the body.
In a way.
In a non-abrasive a way.
Yeah. I'm really listening.
Approach.
Right. I'm listening to the body. I'm listening and reading. I kind of like the reading more.
Yeah.
Because I'm seeing it with my eyes, being like, okay, this leg pulled short when they put both hands above their head. Right. So when they put both hands above their head, this area of the spine, T8 specifically, is having an issue. Well, then that sending a signal up to the brain, and specifically to the cerebellum. Cerebellum says, okay, this is what's going on. Check. Like, I'm writing it down in a history book. This is what's happening. Both hands above the head. T8's unhappy. Got it. Check. So then it sends that signal to the brain. The brain's like the upper part of the brain, and the cranium's like, that's not what should be going on. I don't like that.
Yeah.
Right. So then it can only do two things. Like your brain. This is really weird. Your brain can only do two things.
Okay.
Right. We're gonna dumb it down like crazy.
Let's do it.
Either it's going to cause a muscle reaction.
Okay.
Or a hormone response.
Oh.
That's it. That's all it can do.
Okay.
Right? As far as like pushing
muscle
out
reaction,
data, right? So
hormone response.
So I can contract a muscle. I can relax a muscle.
Okay.
I can push out a hormone or slow down a hormone.
And dive into the hormone part. How do you read a hormone?
Labs are the best way, really. That's
what?
Labs, like do blood labs or urinalysis, right?
So okay.
So that'd be more so that one.
So stress hormone.
Yeah, it's like you could cortisol
oxytocin
and all those things. Yeah, that's the best way, right? You could muscle test and kind of figure out other things. What I'm actually diving into now is with thermography camera pictures. You can actually see hormone responses just through like skin temperature. Really, really fascinating stuff, right? So that's episode 15. So,
okay.
Yeah.
That's so fascinating. Well, I want to share with you my story of chiropractic.
Cool.
A little similar to yours.
Okay.
Where I was in 6th grade, so I was top of the class.
Absolutely.
6th grade.
Way better than a 3rd grader.
And it was recess time. Do you remember recess time?
I love recess.
Favorite time. So it was prominent in my school to play Red Rover, Red Rover.
Chiropractic's best friend.
I believe it. Well, this was my turn. And I was rearing up. I knew exactly where I was going to go. I looked at the lineup of all my friends. I knew where the weak one was, right? Because that's what you have to do. And you run across and you hit into this line of kids that are holding hands. And you're supposed to break through. And if you break through, then you get to take someone back to your team. That's how Red Rover is played. It's my turn. I know exactly where I'm going to go. I rev up and I dive into the hands that clock me right here.
Oh, shoot.
And I lose my breath.
So right in the neck.
Right in the neck. Yep. And I felt all the world turn black, and then
wow,
zing, I was out. And the next thing I knew, I was waking up to Jason Wilberg's face right there saying, "Are you okay?" I didn't feel very good after that. And my friends helped me to stumble back to the teacher who called my parents. And I was taken to the chiropractor. It was Sanders, and he was a gem to me. He cared for me, and he was a crack pop. I always hated being at the edge of the table and having my neck like dangle, and them say, "Okay, just relax,
Wiggle that
just
toe."
relax.
I was like,
Crack.
"Yep."
And you see things differently at that point, and you feel an adjustment, and you feel a breath, And sometimes I would have a headache after that, but I was terrified of bending down and hearing that pop and feeling like, oh, I just messed up all of that. But I started to learn why chiropractic care was different than going to the clinic. I'd broken my hand when I was little. This was not the same case. And I was able to get adjustments when I was feeling headache, or maybe I wasn't able to pay attention in school, right?
It's a big one.
Yes. And I was able to get adjustments. So that's what I knew, chiropractic care. And I also was very aware that my insurance didn't cover it, which I think that's still the case, is that insurance doesn't cover that kind of woo-woo care. And my dad, he was a very open, very intelligent man. He was willing to dive into things that were not of your typical understandings. Like I knew about muscle testing way before I met you, because he taught me how to do that.
That's cool.
And I knew about homeopathic medicines under your tongue. I knew about holding on to certain stones. Like I knew that turquoise was my power stone.
Oh, that's cool.
Right? And amethyst. And so I was open, I would say more open-minded to being open to that kind of practice. And so it wasn't until my daughter, she was in junior high, and several times she would complain about her knee hurting her. And I'm thinking, she's not an old lady. What's going on, right? And sometimes she would wear a brace to school. And I thought, and I admit, I kind of thought maybe she was being a little dramatic. And so I didn't much pay attention to it. And also, like me, where I ignore the problem for a while until it goes away.
Yeah.
And if it doesn't, that's when I choose to bite the bullet and invest in the medical care for it.
Yeah.
And that's where I was with my daughter.
Yeah.
So I'd been to some chiropractic care, and I think the facility was closing down for some reason, and so I was looking for a new chiropractor. And I did actually say a prayer before I started looking, because I wanted to make sure that my daughter was being taken care of, or that I was in tune with where she needed to be taken care of. And I came across Sound Corrections. I called, and your sweet, wonderful receptionist, Sarah, answered.
Oh, love Sarah.
And I told her, I said, I'm not sure where I'm going with things. I'm just in the market to look around and see what is possible. Tell me about Sound Corrections. I just thought, oh, it's so wonderful, and it's not abrasive, and we look at the atlas, and we use sound to adjust the body into place so that it's more functional. And I thought, wow, that's interesting. Well, I'll get back to you, right? I hung up the phone, and there was a zing from the top of my head to the bottom of my toes.
Oh, wow.
And I just had this thought, like, you don't need to look anywhere else.
Wow.
So I turned around, and I called right back up, and I made my first appointment.
Wow.
To come in with Emily.
Dang.
And then our first visit was when you put her on the table and showed me the feet being in, like, just in touching one hip to the other side. Her feet were adjusting within an inch. I remember I asked you if I could take a picture of her feet, because I couldn't believe that there was such a difference. And sure enough, that was the case. And you took her knee and you popped it around. What was it that you said had
Oh,
settled in there?
maybe that was joint clearing.
Joint
Maybe,
clearing.
yeah, so it was just clearing out the scar tissue in the joint. Yeah.
Yeah.
That was a little more abrasive, right? It's not Crackle, but
No.
it can be kind of intense, yeah.
Yeah, but immediately after that first adjustment,
Mm.
after being able to look at the atlas, you didn't do anything with the body until you were able to see the atlas, which was a fascinating thing for me too, because you showed me on the x-ray just even the slightest movement is why my daughter's knee
Yeah.
was hurting her.
Yeah.
And she has not had those complications. And you have been such a gift in our family. I want to share a personal story. Kels and I are in the film industry. And the film industry can become very unpredictable and very stressful. And if you suffer from stress and depression, sometimes it can get to a place where you really feel like you can't function in this world. Well, this is the case with a friend of ours, and he took his own life.
Oh, wow, I didn't know that.
He had some young children that were left behind, even a set of twins. And this was my first experience to have someone that I knew take their own life. It was very traumatic for me.
Yeah.
And I brought Emily in for adjustment, and you must have been so in tune, because immediately you could feel that my energy was off.
This is coming back to me now. I remember this now. Yeah.
And you gave me a free adjustment because you were just so caring and knew that Stephanie needed help. And that's when I learned how you said it. Is there something traumatic that has happened to you? And you were focused on my back, the lower back. You said, this is financial stress or death in the family, or death, I guess is what it was. And you were spot on. And that touched my heart. That touched my life. I knew that you were something special, and I was excited to share you with anybody that I knew, because what I'd experienced myself, I was able to function again. I was able to be a mom.
Yeah.
I was able to be in tune with my daughter and my children. I was able to grieve that I had a friend lose his life, but I was able to give prayer of thanks and gratitude and forgiveness, and to be strong again because of that adjustment. And I so appreciate that. And this is part of the reasons why I recommend you to anybody that I can.
Yeah. I appreciate that. It was a weird connection to be able to understand how your body can react to emotions.
Yeah.
For a long time, I was in denial about it. Right, I was the typical guy.
Need the science of it.
It's like it has to be logical. Everything has to be logical, right? And thankfully, my wife is very patient with me. She's taught me through the years, and I started to be more willing to accept that emotions could do something, right? And one person showed me how very easily, just from a visual perspective, he's like, when you're happy, your head's up, your shoulders back, you're laughing, you have great posture, right? You're just like just happy, right? When you're sad and depressed, you curl down and you're in this flex position.
This is true. Yeah.
And so once he did that, I was able to see very quickly, all right, when someone's coming to me and just presenting to me in any situation, not just at the office, but it's like, okay, is this a physical thing or is this an emotional thing? And most often than not, it really is actually emotional. I had an odd experience a few months ago where someone who came in never had their atlas done because he was fine, right? His atlas was fine. Yeah. I had to do a couple of adjustments, no big deal, and he'd be fine. Well, one day I see him and I'm like, let's just check your atlas again. Let's just see what's going on. So we lay him down, and all of a sudden his leg is an inch short. I'm like, well, what the heck did you do, right? And I start kind of like, just kind of playing around with him. I was like, did you fall down the mountain? Like, what did you do, right? And he's like, no, nothing like that. I'm like, okay. So it's not a physical trauma. All right. Talk to him about stress. And he's like, yeah, okay, I got a lot of stress. Work is pretty rough, and family, and and he started just kind of unloading, right?
Oh.
And this is why I love the title of your podcast. Is like, I'm not a therapist, but I was like, I didn't learn how to be a therapist, but like it's part of the job. It's part of the job. And I'm like, you know what? We're gonna just pause here. We're not gonna charge today. Just go ahead and go home, and check in with yourself. Clear out this emotional stuff. Come back tomorrow. Let's see what's going on. So he comes back in the next day. Sure enough, legs totally even. Everything's in balance again. I'm like, we didn't have to adjust you. Like, it wasn't a chiropractic thing. This is that the cause of your problem was not chiropractic.
Wow.
It really was emotional. That was a huge testament for me to really just say, like, okay, just take a breather for a second and be like, what's really causing this? And you have to be sensitive to that. If you're not, then you're getting half the picture. And so, yeah, thank you for sharing your story about that. That's a powerful story. I forgot about that. So,
it was life-changing for me. It really was. Does relationship show up in our body and the stress that we bring into the chiropractic?
Every day. I mean, if you're having a problem with anyone in your family, right, or a close friend or relative, or it doesn't matter, but relationships, we're here on this earth to learn about relationships, right? That's why we're here, right?
Yeah.
We've got to figure out, how do we play with each other? How do we work with each other? How do we support each other? How do we tolerate each other, right?
Yeah.
I mean, it's all of it, right? And so you have to be sensitive to how are the emotions of that person. And I'm going to like jump to like the most intense, emotional, case I've seen, right? This is in Florida. We were adjusting, I think it was the dad. Yes, it was the dad. So we were adjusting the dad, and, it's now like 2-3 weeks in, with care. And the family's there. And so we pose a question like, hey, what have you guys noticed since Dad's been under care? Right?
Okay.
And the daughter spoke, right? She's like 5 years old. And she's like, yeah, I've noticed something. We're like, what is it? Dad doesn't beat up on Mom anymore. What? I mean, that just shocked me. Just like for the mouths of babes, right? Like, I mean, just here's this honest truth right there. And I was like, okay, well, I'm glad she's not doing it now. That's great. I'm sorry it was before, but that was a lot, like what you're saying, life altering moment for me, because I recognize that when someone's in pain, they cannot think, they cannot function. And like we almost minimize it by saying like, oh, I'm feeling grouchy today, right? It's like, oh yeah, well, you're just grouchy. No, you're in pain. Like, you're in emotional pain. You are struggling. Like, let's call it what it is, right? And we just don't like to be that vulnerable, right? It's hard to be vulnerable in that position and being like, oh, I'm actually seriously hurting. Oh, why are you hurting? I didn't have my favorite cereal today. I'm like, I mean, it could be as simple as that. It really can, right? But it's just like, I mean, that experience is important for you, even if it seems trivial to someone else.
I love that.
Right?
I love that you've given permission to our feelings, that something as small as not having my favorite meal or getting my chocolate for the day,
right,
has just ruined my
my day. It's just really hard. And we make fun of it, but like, for that person, they are experiencing traumatic experiences in their whole being,
Yeah,
right? It's not
yeah.
it's not just in the heart. Like we always say, like, oh, it's your heart chakra. It's like, no, it's your whole body. Like your aura.
That was
It's
real.
real, right?
Yeah.
And when someone is feeling like that, it fills the whole room. I mean, when someone comes in and they're in that grumpy phase,
Yeah.
right? You're like, holy cow, like, just kind of calm down a little bit and
We can
like,
feel that.
what's going on? You know,
That's undeniable energy.
undeniable energy, right? So I see that now, and it's like, okay, well, I'm a chiropractor. What can I do to help that situation, right?
Mm-hmm.
And like, yes, we can talk and we can be friends and we can, talk that out. But I'm not a therapist, right? So,
He's no therapist,
but I'm a
but
chiropractor. So I was like, okay, well, what can I do as a chiropractor? Well, I understand that if I get the body in the best alignment that I can, right? If I using my intellectual knowledge, my skills to get that person in a better alignment, that's going to cause a reduced stress on the brain. If I can reduce the stress on the brain, then that means that the brain is now able to process that emotion clearer, right? So am I causing the stress to calm down? Indirectly, yes.
Okay.
Right? That's what I'm doing, right?
yeah.
And so the other part of it is that healing aspect where just the sheer fact of touching someone, right? Not, it doesn't even have to be a big embrace. It doesn't have to be like, oh, I'm weeping with you. Like, it's just knee to knee. I mean, it could be something as simple as that, right? Me just touching down the spine, right? There's an energy with that. There's a sensation that comes from that where it's like, okay, I'm in that safe place. I can calm down. And again, I'm seeing that from a chiropractic perspective where you have your sympathetic nervous system, your fight or flight, which when people come in, they're in that fight or flight, right?
That's really, I bet
everything's
there are.
emotional and it's intense and it's crazy and like, I'm ramped up, right?
Especially if they haven't been here before. This is their first
Oh, it's scary,
experience.
right? It's totally scary. And like,
what are you going to do to me?
Trying to find a new doctor, and I was like, I don't know who you
Yeah,
are. Like,
right.
are you gonna make fun of me? Are you like, what is it? So then there's the other aspect, which is your parasympathetic. So that's your rest and digest and heal. We always forget that last part. We everyone knows rest and digest and heal, right? So just the sheer fact of me just lightly touching someone, it starts to ramp up that side of the nervous system. Whereas like, okay, now I can be at peace. I can calm down. And all the thoughts in the head start to kind of dissipate and be like, okay, I can get that zen again, right? So chiropractic is a lot more than just moving a bone, all right? That's where like the doctor therapy side of things come into play, and it's hard to teach that.
Yeah,
that's an intuitive thing. That's a human thing.
Yeah.
So
I can see that, and you would want to have kind of natural skills of wanting to be intuitive.
mm-hmm.
I know that requires inspiration.
Yeah. Yeah.
So, Dr. Beadle, I know that you have two beautiful daughters and recently a brand new son who I thoroughly enjoyed holding the other day.
Itty bitty boy. Yeah.
Yes. I know that you have a miracle story, and I would love for you to share that with my audience.
Yeah, happy to. So, my wife and I got married knowing right off the bat that we wouldn't get pregnant through the normal ways, right? We would have to do infertility treatments.
You wanted to start your family?
And, we wanted to, but it was just like, we did the trust in God approach, right?
Right.
If you wanted us to have a kid, great. If you didn't, well, we'll just have to do it on our own at some point later on.
Okay.
Right. And so she has PCOS, and so it just made it to where she just didn't ovulate. That was just how it was, right?
PCOS?
Yeah, polycystic ovarian syndrome. So, anyways,
what is it?
Polycystic ovarian syndrome. Like a lot of people actually do have it.
Yes.
Very common.
Yeah.
It causes lots of issues and such.
A lot of pain.
And she was a long distance runner, so she's skinny weeny, and like you need to have some fat on your bones to actually like produce a baby. How about that, right? and so those two combined, she's very, very active, and also the PCOS is like, we're just not gonna be able to have kids. So I was like, okay, that's how it was. Well, she had low back pain at one point, and again, I'm in that acute phase of things where I'm like, okay, if you have a problem, go to the chiropractor, get it fixed, and walk away, right?
Yeah.
So she went like maybe twice. Maybe. I know at least once. She went once to the chiropractor. And it was a normal snap, crackle, pop chiropractor. Really like the guy. He's a phenomenal doctor. He's here in Orem, Dr. Free. So we went there. And sure enough, I think it was like 2 months later, she wasn't feeling well. We're like, oh, why are you not feeling well, right? And the typical story, we're in denial of it. Someone says, well, you should get a pregnancy test. And we're like, why? That's weird, and so sure enough, she actually does get pregnant, right?
Okay.
And so we're just, jumping for joy. We're like, how like, we'll take it. This is exciting, but like,
right?
How? Right? So we go to the OBGYN. We're like, hey, doc, like, how did this happen, right? And he's looking at us, kind of looking at
Let me explain the birds and the bees.
Birds and the bees. That's exactly what he said. He's like, well, do you need like the birds and the bees talk, or like what? And I'm like, no, like, we're very clear on how the birds and the bees work, right? We're good on that one. But like, seriously, how did this happen? And he's like, I don't know.
Really?
The stars aligned. He's like, I have no clue how this worked. And so we're just looking at each other like, this is weird. Like, how did this, something had to have happened. It could have just been a miracle, right? But then we were like, hey, remember how you had low back pain and you went to the chiropractor? That was like her first time really doing the chiropractic thing, right? Never really done it before. And so sure enough, getting that adjustment opened up her nervous system to where it started functioning better, to where she was able to ovulate at the right time, and the birds and the bees happened, and sure enough, ta-da, we got baby, right? So it's super cool.
Yeah.
So I was like, wow, this is amazing, right?
You didn't even have to go down the infertility road.
You said it correctly. Good job.
This is because I keep saying infidelity instead of infertility. So, we got through that.
Chiropractic cannot help it with infidelity. Maybe it can. I don't know.
Hey,
Never limit something.
That's for another subject.
Yeah, that's episode 99. So. Anywho, so we just thought it was like the one miracle, and we're like, we have a kid. And
so grateful.
Kimberly Beadle, I love her. She's just a star in my eye. I love her so much. She's my oldest, right? Everyone loves their oldest. And so then it's like, okay, well, for baby number 2, maybe chiropractic's the thing. Like, that's just what's going to happen, right? And for another 4 years, nothing, right? So we're like, well, that's a little sad. Right? Like, okay, well, frustrating. Well, then I learned about the upper cervical, the upper neck adjusting.
Okay.
We started getting her under regular care with the upper neck thing. And sure enough, baby number 2 comes. So we're like, this is amazing. As long as you're in great alignment, we're good, right? Yeah. And so that's how we got baby number 2, Claire. And she's just a hilarious kid. I mean, runs all over the place. And she's so much fun. Absolutely fun. And so we're like, okay, well, as long as you stay in alignment, we're good. And then 7 years happened.
7 years.
Right? We have no clue how this little boy came. This is really the true miracle. Like, how did that happen? We have no clue.
Wow.
No clue. We're grateful for him. We're excited. But he is that oops baby and miracle baby all right. Right? It's just like, this is great.
Oopsie miracles.
But we were ready to go down the infertility treatment, right?
Oh, really?
So 2020 happened. Everyone loves 2020. I don't know why, but we all loved it, right?
It's 2020
we talk about it, right? A lot.
Yeah.
So we start treatments. We start getting tested. Starting to see some docs and such. And then pandemic happens, right? And I'm like, let's just wait a little longer. Like, I don't know what's going to happen. So we'll just wait a little bit more. We're not in a rush. It's okay, right? So we wait. We don't do anything as far as actual treatments. It was just lab work. How are things going? That was it. We never started any medications or processes, right?
Yeah.
And then a year goes by, and all of a sudden, boom, we get pregnant. How did that happen? No clue. Because we were at that point where we're like, we need to figure this out with, help. And didn't happen. So
Wow.
what's intriguing is I've had not several patients, right? I can't say that this is the cure for infertility, because obviously it worked great for the first two. Other one, not so much, right?
Well, maybe you needed to have that experience because.
Quite possibly,
Yeah.
right? But there are other people who they've said, we've been trying for 5 years. We started with you, and all of a sudden we're pregnant. I mean, it just, that's a common enough story where it's like, okay, it's not just a fluke,
Yeah.
right? There is something to this. Can I predict it? Absolutely not. That's what's frustrating,
Yeah.
right?
Yeah.
So for some people, when their spine's misaligned, it causes nerve interference for their ovaries or for testes, or I don't know, right? But it turns it on to where it's like, okay, now we're in this environment that we can have a child.
They're relaxed. They're not stressed. They're not in pain.
Yeah.
That makes sense to me.
Yeah.
You have pre-birth and after-birth care with your chiropractic, don't you?
Yeah. So because of that experience with my wife, I really love pregnancy. Like, the prenatal care is so much fun. I love working with kids, and that's where my passion comes in. So I always joke like I love every patient, right? Like, but if you're if you're a pregnant mom, it's like, I am a kid at a candy store. I'm like, this is great. I am excited to work with you, right?
Oh,
Like,
wow.
it's just so much fun, and it's, for me, it's like you're choosing me out of all the other people in the world to be part of your birth team, right? Like, I'm not just here to, like, I'm going to line your spine and make you feel okay. It's like, no, like, I'm part of your birth team.
Yeah.
And that's exciting because that's a small group, right? You don't invite the whole world to your birth,
True.
right? It's a very intimate type of setting.
Correct.
And so being part of that system, being part of that team, is just a blast. It's so much fun. I've had the opportunities to go to a few births also, like at home, when people birth at home, and they're like, I need help. So I go down there and they're struggling to, get things going. It's called dystocia, right? Baby's coming, all of a sudden just stops, right?
Okay. Yep. I experienced that.
Okay, so it's called dystocia. So went to this family, and she had, I think, had been laboring for almost 3 days, like,
Oh,
rough,
no.
really, really rough. And
Oof.
so went down there, helped them out, and her pubic symphysis was out at the front of the pelvis, was way, way out. Adjusted that, and all of a sudden, boom, baby started
came.
like coming. Like, it was so cool. It was,
Wow.
the midwife was like, how did you know that that's what you needed? I'm like, the spirit told me. I don't know, like, that's just what intuition, right?
Right.
And so things like that are just so much fun. I mean, that's, you're in this transition of life, and you're seeing, baby being born. Like, it's the coolest experience. I love it. I absolutely love that. So that's fun for
Wow.
me.
I love that you shared the story of the father and the little girl who shared with you, my dad's not angry anymore, right? And I love that you shared the story of your wife and the adjustment and that coming into helping to care for those complications. Where can my audience get more information about the services that you have, what to expect when they come in? Do you have testimonials from?
Yeah. So very simply, we have a website, right? Everyone has a website.
Uh-huh.
So soundcorrections.com. That's our website. We're also on Facebook. You can Google us. You'll find us either one of those ways.
Are you on Instagram?
On Instagram too. That's my wife.
Oh,
I don't know how to do Instagram. I'm barely learning, but that's my wife on that one. So yeah, you can find us either one of those ways. Calling us is probably the best way. If you have questions and you're like, I just want to talk to the doctor, we'll set that up, and free consultation, no big deal.
Yeah.
No obligations, no, like, I'm not going to strong arm you into care or something, but that's the easiest way. And if, we have people flying from out of the nation, right? So I have people flying from Europe to come to here, but not everyone can do that. And so that's why I also created the ucreferral.com so that people can find an upper cervical doctor close to them. Right.
Okay.
That's great too. So
That is fantastic.
Either way, like, just get good care. That's what you need, and everyone should have a good chiropractor. It helps out with so much.
I love that. James, thank you for being here. Thank you for opening your heart and sharing your stories, your personal stories, and what you've experienced, and the knowledge that you have, and for being my friend.
Absolutely, 100%. I love it.
If you've enjoyed this episode, remember to subscribe, share, like us on Facebook, and follow us on Instagram. Please comment, because I would love to hear about what you think and what you want to see in the future. I'm no therapist, but I am your host, Stephanie Goodman.